What we know now is how terribly important early experiences that children have are in sculpting their brain and influencing their development, their biological development. And we understand that various layers of their intimate environments matter. So the environment of what goes on in the family matters, and the neighborhood matters, and the programs and services that they are exposed to matter as well. So in effect, children grow according to the qualities of stimulation, support, and nurturance that they get on a moment-to-moment basis throughout their waking hours. And that this is more important than just sitting back and waiting for maturational milestones to be hit. We want to be able to tell whether or not the environments that children are growing up in are working for them or not. One way to do that might be to follow them around with cameras and film everything and evaluate it, but of course that's way too expensive and intrusive. The other way, though, is to say we understand that the state of children's development reflects the quality of the environments that they've grown up in. So if we find a way to measure their physical development, their social and their emotional development, and their language development and communication skills, we can use that to say whether or not they've grown up in the kind of environments that we would like our children to have. And that's the basis of the early development instrument, to do just exactly that.
The early development instrument is not intended as an assessment of an individual child, yet it's a reflection of the quality of environments that children have been exposed to in their early years. We take the information from the EDI and we map it according to community boundaries. And then we work with the various stakeholders from those communities, be it community people, school district, or policymakers. And to ensure that the information that they're getting from the EDI will inform services and programs that will create the optimal environments for the young children in those communities to thrive.
One of the things that we do when we get the EDI data is we put it together with other research information that we have. So we look at socioeconomics, because there are certainly socioeconomic factors that impact children. And we also look at community assets. So community assets are all the programs and supports that are available in the community. So we'll look at a neighborhood and we will look at the EDI data. We'll look at how children are doing, poverty levels, the mobility, how many single parents, and then we'll look at what's in the community. Are there community centers? Are there libraries? Are there early childhood programs? And we put all of that together to really try and focus programs and supports in the right neighborhoods.
It's actually a really interesting timing for all of this for us because of this new mandate for early learning. We've used the EDI before to help us think of where resources ought to go, but those resources were K-12. And now we have resources to use that EDI information to guide in terms of placing those resources where the most vulnerable kids are. And I think that's probably the simplest use of the EDI, and it's pretty obvious. You're going to identify where the kids have needs and you're going to try to put some resources there. Let's do more in the right places.
Well, I think the EDI it opens an avenue for dialogue with outside agencies, but it also provides an opportunity for dialogue with public health, with other community partners, with librarians, anything or anybody who's working with children and families. I think are really interested in what the EDI is showing. And again, what we're trying to do is just strengthen families, whether it's through community programs, library programs, family place programs.
I'm an elder from the Shuswap Nation. I belong to the Canoe Creek Band. And I feel that the EDI tool is essential to identifying gaps in our children's development. The EDI has been an exceptional resource that we've had to use in, I guess, proving the point that we needed more Aboriginal infant development programs within this province. And by using that resource, we were able to achieve I know at least one new program in the province.
I've been teaching early primary for 15 years, and I've had the opportunity to take part in the EDI project a few times. It's been very helpful to me because it's given me the opportunity to really look at my students and gives me the whole picture of the child and how ready they are for school. I know that when I'm taking part in EDI that the research is going to help the kids in our community, the preschoolers and upcoming kindergartens. So by providing opportunities for early childhood programs, library programs, Strong Start centers, all of those help increase their children's readiness for kindergarten in the upcoming years. So I know it's a benefit to all of us.
It's important to think about community and what is community. And community to us is working with the early child development community coalitions, with the school districts, with health authorities. All of those people influence and shape what happens at the level of the community for those children.
Thanks to the kindergarten teachers in British Columbia, we've managed to demonstrate that you can take a tool like the early development instrument and scale it up to the level of the population so that we can understand about whether or not children are growing up in environments that work for them, and to tell whether or not we're improving them over time. So it serves as this wonderful capacity building tool. We've taken that now around the world, and as a result of that, over a dozen countries are using the early development instrument in the same way that we are here. And we're getting to the point now where you can start to imagine a world where societies will judge themselves based on whether or not they are making a difference for children in their early years across these key domains of their physical, their social, emotional, and their language and communication skills development. And that's something that the kindergarten teachers of British Columbia have pioneered for the world.